Okay, we are on now. Into the brother? No, oh, you want the volume for the so that you can. Oh, yeah. I said you about 70, 60, 60. Yeah. Okay. Good afternoon. This is Dr. Gombele from drg.com. As it was advertised for the past 1 week, 2 weeks, that today we're going to have another series of questions and answers, but we are going to be doing that only on YouTube. I remember last time we did it on Facebook and YouTube, but today we are going to focus only on our YouTube subscribers. So thank you very much for inviting me into your privacy. My name is Dr. Gombele from drg.com. Motivational, inspirational, and of course, educational YouTube channel where we mainly focus on health-related issues. And our area of focus is diabetes. And today, as last time, I would like to answer first 10 questions that I have. And these questions come from WhatsApp, Facebook, Messenger, and also our subscribers from YouTube. So remember, there's a click on the chat if you want to come alive, or you can just communicate with me on the chat. Question number 1. This question talks about my meal plan that I put out on Facebook in the month of November. The month of November is the month that we celebrate, we raise awareness for diabetes. So I contributed by putting my meal plan for 1 month online, and people also were happy to have the meal plan. But this first question is concerning my meal plan, and the writer says this: why in your diet you don't use sweet potato? Sweet potato is an issue whenever you tell people that they should not eat sweet potato when they are diabetics, because as you know, sweet potato may be good for many other reasons, but for type 2 diabetes, type 1 diabetes, gestational diabetes, drug-induced diabetes, where we have to keep the blood glucose within the normal range, sweet potato is not really the right item. And the patient, the question say why. One is for the glycemic index. What is glycemic index? Glycemic index is whatever we consume and spikes the sugar high. Originally, sweet potato has a low glycemic index, but if you roast it, glycemic index change. If you boil it, glycemic index change. If you put it in the oven, you bake it, glycemic index change. And from normal to sometimes very, very high, all right? So because you don't know what people will be cooking, what people will be doing home, I just advise that no sweet potato. The other way to prove it for yourself is consume sweet potato, baking, or sometimes they use sweet potato to do pudding, all kind of stuff. Just consume sweet potato, and 2 hours after you have consumed sweet potato, then check your blood glucose. You are going to see it will be very high. It also depends on the quantity that you consume. So that's why I just decided, well, no to sweet potato, particularly if you are newly diagnosed and the blood is very high. Once the blood has come down to normal range, you can eat once in a while. Small portion may not affect your blood glucose, but if your reading is 30 high and you want to reverse coming from 25, 29, I say that no to sweet potato until the blood glucose returns to normal, and then you can try once in a while small portions. That's the reason why. Question number 2. This question keeps on coming over and over. Can type 1 diabetes be reversed? Oh, no, this type 1. Unfortunately, no. Type 1 diabetes cannot be reversed and cannot be prevented either. Because when it comes, normally it comes as a result of an infection, and that infection affects the pancreas. As a result of that infection affecting the pancreas, then the beta cells, which are the cells that produce insulin, get destroyed, and there is no production of insulin, or just a little bit production of insulin, or completely zero production of insulin, and the sugar in the blood start going higher and higher, and we call that one what? Type 1 diabetes. Treatment, insulin. But guess what? If you eat food that do not spike your sugar very, very high, then you're going to use a small amount of insulin. All right? But if you consume food that spike your blood sugar very, very high, then your amount of insulin will be very high, right? We cannot reverse it. We cannot reverse it, cannot be prevented, but can be managed by diet. All right? So the same type of diet for type 2 diabetes, I encourage people with type 1 diabetes to use it so that they can minimize the amount of insulin they use. Question number 3. This is Dr. Gombele live streaming, talking about diabetes and lifestyle. And I am from drg.com, which is a YouTube channel that particularly focuses on health issue. And today we are talking about diabetes in general. So I'm going to answer question number 3. How about using honey if you are diabetic? Well, regardless where the sugar is, the sweetness is coming from, when it gets in the bloodstream, not good, right? Not because it's honey, because it is sugar cane, because it is sweetness coming from fruit. Once it gets into the body, the effect is the same, spikes the blood sugar. I have numerous situations where trying to reverse or bring down the diabetes, and people tell me they have good diet, they eat well and they exercise, you know, but when I check, they eat too much of jackfruit, they eat a lot of pineapples, and when they make the tea, they use honey. And the sugar is high, right? So honey cannot be used. And then again, it depends, use your discretion. If you are reversing the diabetes, no, no, no. If you have reversed your diabetes and your sugar is within the normal range, 1 coffee spoon may not hurt much, but do not drink it, right? Do not drink it. And I had a friend called me from Choluteca, Honduras. Se llama Karen, una amiga. We studied together in another university. And then she called me very distressed that she went to do her blood test and she borderline, right? And then A1C is high. So she's diabetic. And she started telling me she does not eat meat, she exercises, she's not fat, her body mass index, it's within the normal range. But what I see on Facebook, she lives in a very nice farm. She has a lot of mangoes, a lot of pineapples, and she produces honey. And guess what? She mixes honey with almond milk and she drinks it every day. And she uses honey to do a baking, and she uses honey to drink and to drink and to sell. And she doesn't have history of diabetes in the family. So when I started asking her, she said, no, she drinks honey. I said, well, you have to cut it down. And people always come with the question about meat eating. Oh, but I don't eat meat. But how am I having problem to control my diabetes? And I tell them, we know red meat is not good for other health issues. But where diabetes is concerned, it doesn't have much impact, right? What impacts on diabetes are what? Carbohydrates, right? And then anything that is sweet, like my friend calling me last night. And she drinks honey, and she bakes with honey, she uses honey with tea, and she produces honey, and she sells honey, right? Using honey for skin or for other beauty related issue, great. But if you're a diabetes patient, honey shouldn't be seen very often on your table. Or if also you are trying to lose weight, right? Honey shouldn't be consumed because what? When you consume honey, it spikes sugar, and once the sugar is high, the pancreas produces insulin, and any high level of insulin in your blood, it gathers fat, fat in the tummy and fat in other areas of your body. Question: diabetes? No. If yes, very, very careful on the amount of honey that you consume. Question number 4. Is polycystic ovarian syndrome connected to diabetes? I'm not sure about this. Or is she trying to say that is polycystic ovarian syndrome, can it lead to diabetes? If that is the question, yes, because in fact, polycystic ovarian syndrome, it's among the risk factors for a person to develop diabetes. Okay, I see people coming. Chrissy Senior, interesting thought, Doc. Great. I see Dulcie Stewart. Good evening, Dr. Gombele. Good evening, Dulcie Stewart. I don't want to say where. I know so many Dulcie. Is this one from Maryland? I think yes, because Dulcie from Belize is Dulcie Harvey. All right, welcome to the show. So I'm here to answer your questions, and if you have any, you can just write on the chat. And if you want to be seen on live, you have a link that you can click. So we continue answering questions, and you can write your question in the chat, and we can gladly address your question. So we say that yes, polycystic ovary syndrome, it is a risk factors. It's one of the risk factors to develop diabetes type 2 because they share many things in common. As you may have seen, that most of the ladies suffering from polycystic ovarian syndrome, they tend to have a little bit they tend to be a little bit overweight. And we have said earlier, overweight or obesity are single most important risk factors for developing diabetes. This is to say, you have never had diabetes history in your family, but if you're obese or you're overweight, you can indeed develop diabetes. Chris Senior asks, is it okay for diabetics to have green or fruit smoothies? Well, green smoothies are okay as long as they remain greens and they don't have too much of fruit that are very sweet. But fruit smoothies, I will get back to my question that I answered before. Diabetes patients must be careful on fruit because fruits have a sugar that we call fructose. And fructose can also elevate the blood sugar. I can tell you, like mangoes, ripe bananas, pineapples, oranges, if you consume in excess, they will affect the blood sugar, right? And then during mango season in Jamaica, we have a lot of types of mango seasons. And they ask patient, what happened? Your sugar so high. They ate dozens of mango. Can you imagine? Dozens of mangoes, right? They're not saying, Doc, I ate a slice. They ate a dozens of mango. That's just not right. If you really, really, want to eat mangoes, eat maybe one slice or, one mangoes, but dozens, you know how much sugar that is. All right. So yes, smoothie from fruits can affect your blood sugar, depending also on the type of fruit that you use to make your smoothie. Interesting question. Okay, this is Dulcie Stewart, my old good friend from Maryland, US. Okay, Dulcie, good morning, good afternoon. We're in Jamaica here, and I hope you're okay. I don't know if you still have a question to write before I move on. Question number 5 that I have from other people. This one came again with polycystic ovarian syndrome. Can polycystic ovarian syndrome be cured? I'm not sure about the cure, but I know it can be reversed, right? I know. I have helped 2 or 3 ladies to reverse their polycystic ovarian syndrome. And then here again, diet and lifestyle come in to be played. Yes, maybe not to all, but some have changed their lifestyle, and then the period became regular. And as a result of period becoming regular, they conceived, they had children. And one thing that can affect you from getting pregnant is too much insulin. And in some of my presentations, I have said that what diabetes patient type 2 have is not lack of insulin, it's what too much insulin. And insulin, in fact, can affect you, can affect, can prevent you from becoming pregnant. Question number 6. Can diabetes mellitus affect pregnancy? Oh, yes, definitely. It can. It can. That's why we have to do screening, right? Within 24 and 28 of your pregnancy, we have to screen for diabetes type 2. And then if we find that you have diabetes type 2, we take it seriously. We tell you diet or we go on insulin, right? So that we can really control diabetes so that we can avoid a complication of the pregnancy. One of the complications is that you're going to have a huge baby, right? And having huge baby, put the same baby to develop diabetes in adult, right? To the baby, you are going to have also problem to deliver, or you have to do C-section, or they have to do episiotomy. You mean to open the vagina so that the baby can be delivered, right? So it can affect the pregnancy, and then it can also affect the mother. How? Though most of the diabetes diagnosed during pregnancy subsides, but they come back. Now, if you are diabetic already and you get pregnant, as long as your sugar is controlled, you can have normal pregnancy. But if your sugar has never been controlled and you have already problems with the kidneys, you have already had issues, you have circulation problem, then that pregnancy must be managed with obstetrician and internists and nutritionists so they can make sure that pregnancy doesn't develop problems. So this is Dr. Gombele from drg.com. We are streaming here live. So we have Chris Senior here. We have Dulce Stewart from Maryland. And then we are now answering questions of person that have sent to me, whether on Facebook, WhatsApp, or on YouTube. So we have 11 questions, and we have so far answered 6 of them. Question number 7. How do you reverse type 2 diabetes mellitus? Okay, we say that diabetes type 2 mellitus is reversible, and I'm not changing my position. It is. I have helped many to reverse, but I won't tell you you have to do this to reverse. It's a lot of things involved to reverse. We have to see your weight. Is your weight out of range? We have to bring down the weight. Are you having any other medical conditions? Are you taking any medication that can lead to diabetes type 2? And then we come down to diet. We like to see what is that you are eating, right? What is that you are drinking, your lifestyle? Because there are so many factors that can make you develop diabetes type 2. Remember, it's a lifestyle disease. And if you want to reverse, we have to do a very rigid examination of your lifestyle disease. And I tell people that do not do it alone. You must be under guidance of a person who knows. Okay, I see Karen Gombele. He's here with us from St. Andrew. Okay, and I see Facing Reality. Okay, I know who she is. She's a patient of mine. She's Tamika. I know who you are. I know you are. Welcome to our live conversation on diabetes. Okay, Tamika, welcome. You are free to ask questions as well. Okay, so we are answering how do you reverse type 2 diabetes mellitus. I said it earlier. You can just get and start doing. You need to be assessed. You need to learn first. And I suggest that you be under the supervision of a person who knows how, right? Maybe for 5 weeks to 12 weeks. Some reverse in 4 weeks, some reverse in 6, 10. But between 4 to 12 weeks, you must be able to reverse. And then by that time, you must have learned the technique, how. And you will not get panicked if you get up in the morning and the sugar is high. The same question, what did I do? What did I eat? Right? So that you go back, you see, oh, I ate this, oh, I ate that. And you stop consuming that. In a few days, the sugar will go down, right? Yes, it can be reversed. Don't do it yourself. Find somebody who knows. Or here we are in our YouTube channel. Subscribe. We will send you a meal plan. We will send you food sampling of others who have reversed what they have been eating and what they are eating, right? This is what I'm going to do with my friend Karen from Choluteca, Honduras. So I'm going to assess her meal plan and I'm going to tell her what she's eating. And after we have finished that, I will now send her the meal plan and I will tell her to send me whatever she eats maybe twice a week and send me a blood reading once a week or twice a week. And that's how we take it. I am okay. This is a question coming from Dulce Stewart from Maryland. I am 3 and craving sweets. Okay. This is a question that comes over and over. It seems like the more you have sugar in your body, the more your body needs sugar. You know, so you have to fight it, Dulce, and I know you can. You have a strong will. I know as a very strong lady. So you have to fight those craving for sweetness. All right. So you have to substitute now by nuts. All right. by apples, you feel for sweet, you eat something else. And the best way to fight the craving for sweetness is exercise, right? So you have to have a very regular time for exercise. If it's every other day, you keep every other day. You don't miss, right? And if you feel for like you want a sweet, drink a cup of tea, green tea, or eat some other things. And then if you do that for a good period of time, you will win the craving for sweet, right? So you have to fight it. And in this channel, we're teaching you how to fight back, right? Not because you are craving for sweet, you just have to indulge for sweet. No, you have to say no, right? This is not where the mind must play over the matter, right? So you have to fight back. Say no to sweet, and you eat something, or you drink something, or no, you eat the apple, you eat cherries, you eat something else, right? And to fight that feeling that your body is requesting for sweet, right? Okay, Dulce, Stewart, that's what you are going to do. You have to fight back. So, what are the complications of diabetes? Okay, I think I did a post last week on YouTube. So, if you're not subscribed, so go on YouTube, type Dr. Gombele. You're going to go right into my channel, and then you're going to see the post, the complication. You're welcome, Dulce. Thank you for being with us. If you have any other question, you can ask. So I'm going to put again the link so that those who want to come live, they can use the link and we can see them and they can ask their questions. That's interesting. I'm a pre. That means she's a pre-diabetic. That means the sugar is high, but not really high to to be called a full-blown diabetic. All right. Question number question number 9. Okay, I see something here on the screen. I'm a pre-technical director. We are seeing something here. She wrote a question and came on the screen. Yeah. Okay. One of them will come in as well. It will just be as time goes by. Okay, all right. Chris Senior has a question. I have those cravings. What I used was active prayer. Amen. Somebody used prayer, meaning I prayed, but I also made deliberate choices and changes. Okay. Dulcie, there's an answer here now. Chris Senior says prayer and deliberate choices. And Dulcie, I know you also pray. So if it worked for Chris Senior, it can also work for you. So Chris Senior says that prayer and deliberate choices, that deliberate choices are what? As that you choose what is right. And you refuse to choose what you know when you consume is going to affect your diabetes. This is Dr. Gombele from drg.com, streaming live and talking about the topic that I like, diabetes mellitus. And I'm thankful for you joining me and asking your questions that others also can benefit. We are streaming live and we are also chatting. And I'm reading questions. Do say, Sarah, say amen. Okay. Do say. So you just do as Chris Senior did. Prior and deliberate choices. that will not affect her or his medical condition. I'm newly diagnosed and I'm put on insulin. Is that right? Well, I'm not sure why you were put on insulin. As I indicated earlier, if you come to the hospital, you have an infection, your sugar, the machine cannot read it, you are into coma, which you call DKA, diabetic ketoacidosis. Definitely we have to bring sugar rapidly and we use insulin. Or you had an infected foot and the surgeon wants to do his work and the sugar is always high. So what the surgeon will do, will put you on insulin and then he will do his surgery. And this is what I realized, and most of the time, after the surgeon has done his work, you are discharged on insulin. And then now you go to your general practitioner, he or she keeps you on insulin too. I don't do that. When they come to me on insulin, the surgery done, the wound healing well, the sugar under control, I titrate you off insulin. That means I take you slowly off insulin and I replace oral medication. But guess what? Why do I do it? Because insulin makes you fat. And the fatter you get, more insulin you're going to need. More insulin you're going to need, and you're going to need too much doses of insulin. And the more doses of insulin you need, the fatter you become, and you get trapped into a cycle. Insulin, fatness, more insulin, more fatness, more insulin, right? So the best thing to do is after the surgery or after the medical condition has been controlled, go back to your doctor and tell the doctor that I want to go back on oral medication, right? So in your case, I'm not sure why you're put on insulin, but you need to see, right? If you're okay, you don't have any infection, you don't have any sickness, so that you can go back on oral medication, right? So, but starting the treatment of diabetes with insulin is not the right choice because insulin will complicate the whole situation. Okay, so this is now question number 11. Sorry. How do I take off the extra hair on my face? Definitely, this is a person who has polycystic ovarian syndrome. And then one of the signs that we know that a person has polycystic ovarian syndrome, irregularity of periods. They have period like every 6 months or every year, all right? And sometimes they will tell you it's 3 to 4 or 2 years I've seen my period. Two, they may have hair in certain areas of their body that they shouldn't have, all right? And then 3, we do other tests. And then 4, we have to do an ultrasound. And I think if you have 3 of the 4, then we send you to the gynecologist and we say you have polycystic ovarian syndrome. Those that I see, I put them on a diet, right? Now, when they have excess of hair, it may be due to too much insulin in the body. And insulin is a growth hormone, right? It makes things to grow out of proportion. That's why they're a bit overweight. That's why they can see the air growing in certain area. And unfortunately, if they have other medical condition or they have cancer, that cancer will be manifested rapidly, right? So that's what insulin does. It's a growth hormone, right? And because they have too much insulin in their body, and why they have too much insulin? Because they have insulin resistance, right? And then that's what they develop too much insulin in their body, right? So that's why they have the air growing. But I tell you what, the air factor, yes, I know it's very uncomfortable, but there are many issues that are more important than the air, right? So you just trim the air, right? And just make it, yeah, just keep, some people plug it, some people trim it, But what about the diabetes? What about the heart condition? What about the high cholesterol? What about being overweight or being obese put you to the risk of developing 20 cancers, right? Because just being overweight or obese predisposes you to 20 cancers because obesity is responsible for 20% of all the cancers. I mean, right? So if you compare with that, the air here and there, yes, not good aesthetically, but just go to the salon and get it off and use some cream. Make sure you don't have it off, as men do every morning. We shave. And if you don't shave, start growing, and we shave every morning, 10 to 15 minutes. All right? So that's a part of the problem that you have to learn to deal with. Okay? But not only focus on the air or not being able to conceive, but there are many other medical conditions that you need to look for. Cervical cancer. So you do pap smear every day, reducing your body weight, right? Because polycystic ovarian syndrome patients tend to have obesity or overweight. If you're in a place where you can check your insulin level, check your insulin level. If the insulin level is very high, not good. So you change your diet, all right? So you go on ground produced food. You completely stop added sugar. That also include fruit, the honey. Okay? So sorry, you may not have a child, but you have to be healthy, right? You may have a child, you are not healthy, you need to have good health to have the child. All right? So I suggest that have a holistic approach if you have polycystic ovarian syndrome. Okay? So not having a child, but you have to be healthy. So you still have to lose weight. You still have to check your insulin level. You still have to do your pap smear, do your mammogram. You still have to eat healthy, right? So what I realized is that when you lose weight, you start eating healthy. Sometimes you can get pregnant, right? As the case I have dealt with, right? Because when you do that, you lose weight, you normalize your period, and once your period is normalized, chances of getting pregnant are it's very high. Okay, Chris Senior comes back. Doc, I'm reading a question. Doc, can diabetes cause infertility in women and impotence in men? Also, can type 2 diabetes lead to Alzheimer? Wow. One question, but it touches many aspects of what diabetes can do. I'm starting from the first aspect of the question. Can diabetes cause infertility in women? Yes. Remember we say, especially if it's type 2 diabetes, it can, because it brings too much insulin, and then insulin can affect your pregnancy. In fact, we have seen where miscarriage is prevalent in ladies with uncontrolled diabetes than among ladies with normal blood sugar. Miscarriage, right? That's one. Can also diabetes cause impotence in men? Yes. All right. In my post just last few days ago, when I talked about the complication of diabetes type 2, impotence is one of the complications. And then we said, what are the vessels that are affected here? We have what? We have the nerves, and we also have the artery, right? Because diabetes make the artery shrink. And when men have an erection, it is nothing that the flow of blood that rush and penetrate in the penis within the vessels. Now, when the sickle cell have what we call that prolonged priapism, which is prolonged erection, and they can have erection for hours. What really happened? Like the rush of the blood in the penis, and the blood got stuck in the penis, right? Cannot come out, and sometimes we have to bleed the penis. In fact, they have to be admitted, and the urologist will come and bleed the penis. So there is a sequestration of the blood within the penis that the penis can come out. But unfortunately, that's not the case with the diabetes, is that the vessel gets too small that the flow of blood cannot get to the penis. That's one. Two, the filling, right, is not there because the nerve in the penis is what? Is affected by what? By too much blood sugar, all right? And that is the problem among diabetics. Indeed, diabetes can cause infertility in women, can lead into impotence in men, which we call erectile dysfunction. Okay. The last aspect of the question is also, can diabetes type 2 lead to Alzheimer's disease? Very interesting. In fact, Alzheimer's disease, it's also known as type 3 diabetes. Really? Yes. In the medical literature, we refer to Alzheimer as type 3 diabetes. Why? Because the same way the body resists insulin to develop type 2 diabetes is the same way the brain resists insulin, right? And when the brain resists insulin, so it creates problem. Even though the function of insulin in the brain may be different from the function of insulin in the rest of the body. So it is really insulin resistance in the brain that lead to Alzheimer. It's also the shrinking or the calcification of the vessels in the brain, in the arteries of the brain, that lead to the Alzheimer. When the brain become calcified, develop some plaques there, so it also decreases the flow of the blood. When there is a decrease of the flow of the blood in the vessel, in the brain, the oxygen and the glucose and the mineral and the vitamin also get what? Decreased, right? So yes, and we find a correlation between type 2 diabetes and Alzheimer's disease. So if you have 100 people with diabetes, or let's say you have 100 people with Alzheimer's, right? Among them, you are going to have a lot with diabetes, but we have still not got to why, but we are just trying to read to see that yes, definitely most of the patients with Alzheimer, they also have diabetes, right? So definitely, but I cannot say like type 2 diabetes definitely lead to Alzheimer's, because many other people have Alzheimer's and they are not diabetes, right? They don't have diabetes type 2. But what we find, like most of them do have diabetes type 2. Interesting. Oh, yes, Dulce Stewart. Interesting. So we are learning. That's why we are here to learn, to empower ourselves, to be in charge to a certain extent of our life. And remember when I spoke about the 10 mistakes that diabetes patients do. Among those mistakes, I pointed out that they rely too much on us, right? I want them to take charge of certain aspects of their life, such as examining your feet, such as checking your blood glucose twice a week, such as knowing what to eat and not to eat, such as knowing your weight and how the body mass index is important, right? Knowing as to read your urine, the urine dipstick. You don't have to go to moon to learn how to do that. A nurse can teach you how to do that. You buy the strips and at home you check your urine, all right? So that when you go to the doctor, you can have a very good conversation. Doctors like when you ask questions, right? But the only time you check your sugar is at the doctor office. The only time you know about your blood pressure at the doctor office. The only time you check your urine at the doctor office. That's not right. That's not good, right? That's not helping yourself, okay? Because you see the doctor maybe once every 3 months. So what do you do in the 3 months? Just eat everything, sleep. You don't even care how your sugar is behaving. So this is what we're all about. Empowering you to get some aspect of life under control by doing what you are expected to do. I'm inviting those who are with us in the YouTube channel to invite your friends to join by subscribing, and you do the sharing, right? So our goal is to hit 1,000 by May, and now we have 342. So we still have a long way to go. So we want you to invite your friend to join the group, to join the family, and to get educated. If you have a problem, you are welcome to leave a comment in the YouTube and we will address the comment. All right. I see a question here on my in another group. What you mean by lifestyle modification for polycystic ovarian syndrome? What is the best way to get the extra hair grow in places like face and where it should be? I think I did answer this question already, but I will have to text uh, this concerned person what to do, right? So the last question was the air, what I did answer. So I am Dr. Gombele from drg.com, streaming live today, Sunday the 28th, the last day of the month, and it is now 2:50 p.m. in Jamaica. It should be like what? 10:50 p.m. in Nairobi, Kenya, East Africa, Tanzania. It should be like 9:51 in the Democratic Republic of Congo. And then here in Jamaica is 2:51. Thank you very much for your questions. We have 9 more minutes to go. When you to share the videos, to invite your family, your friends, your colleagues, your associates. We want to hit 1,000 subscribed in May. The latest one is in June. We want the community to grow, and I can understand everybody asking question here. They are subscribed, right? Technical director, you must be subscribed to ask the question here. Yeah, but we don't want it to be selfish. We want you to invite your friends, your family members to learn about diabetes. You will hear people dying of stroke, dying of heart attack, losing their lower limb, and most of those could have been what? Avoided. And in the doctor office, most of the time, we don't have the time to tell you what to do and how to do and what is happening. So this is a place for you to learn, to ask questions, leave a question there. We will check our box and we will gladly answer your questions. This is Dr. Gombele from drg.com. We are streaming live today from Kingston, Jamaica, and we are glad to have you asking your questions. And I'm happy and I hope that our answers did satisfy your curiosity. So I'm going to take one more few questions, and that will be 2 o'clock. We have 7 minutes to go. I want to say something about the patient with polycystic ovarian syndrome. All right? It is the most, how should I say? It is one of the reasons ladies will miss their period and they are not pregnant. All right? It is the reason why ladies will not see their period. All right? And in many cultures, is a taboo. Okay? People don't talk about. And then now we have a lot of facilities, a lot of groups that are out there, right? Coaching and inviting people to join to learn about the disease. So a problem that you don't know, you always get panicked, right? And the more you know, the more you can live with the problem, right? So come forward, subscribe, and ask questions, right? But what I really want to say is this, and I know to get pregnant is very important, but do not miss diabetes. Do not forget about cancers. Do not forget about heart condition. Do not forget about high blood pressure. That also come with the polycystic ovarian syndrome. Yeah, because you may be a bit overweight, right? While focusing on how to get pregnant, focusing on how to plug the air on your face, and as somebody say, and in other areas that shouldn't be there, make sure you get your body weight in order. Make sure you eat the right food. Make sure you do your pap smear. Make sure you check your cholesterol. Make certain you check your pressure, right? Because it's like a package, right? While you focus on one thing, you may miss the rest. I see another comment here. Christina, blessing upon you, dog. Oh, thank you. I'm sharing the videos on my YouTube channel, and otherwise, God bless you always. Oh, thank you very much. May He bless you in your ministry. Okay, great. This is a ministry I'm in now, right? Good. Thank you very much. And without you, we will not be able to carry on this ministry. Invite a friend, share the video, and tell them to subscribe. What about drinking bitter tea? Is that also good for diabetes? Well, I know bitter melon. I know that is good for diabetes. And then somebody said everything that is bitter is good for your health. All right. So drink bitter tea, and after you have done so, 2 hours after, check your sugar and let me know. And I'm going to remind you the reading. You get up in the morning in fasting to check up your sugar, must be between 4 to 6, right? But if it's 7, 8, it's okay, not a big deal. Better 7, 8 than 20 and than 30, okay? But make sure the sugar to be between 5 to 6, right? Now, the 2 hour, no, after you have drank or you have eaten, shouldn't be less than 9, right? So you do that. And that's how you know that whatever you eat, it's good or not. You eat a good meal, nice. And 2 hours after you check your sugar is all over the place, that meal should not be eaten again because that meal is not good for you. That's another way you can check whether the food is good or not. You have your dinner at 5, supper, 6 was the last thing you have eaten. You go to your bed, you get up in the morning, the fasting blood sugar very, very high. Who to blame? Nobody else than the meal you ate before you went to your bed. Remember to always ask yourself a question: what did I eat? Right? So what about drinking bitter tea? That's what I said. It's already, it seems like anything bitter, it's good for the health. So bitter tea, it's good. But remember, this tea wouldn't have sugar, wouldn't put honey in it. Just bitter, just like that. All right? And I don't think it really have to affect anything. Any bush that you drink that you don't add sugar, you don't add honey, I don't think it will affect your sugar anyway. All right? If anything, it will help to lower the sugar than to increase the blood sugar. 2:59. We are not going to abuse of your time. Thank you very much. I like this time. More interaction, more questions, more people came on board. So the video will be on YouTube as long as you want. You can go back. You can go back to listen to the video. You can ask more questions at the end of the video. We can still address those questions. You can invite more people. You can share it. It's also, we can share the video. Yeah, on Facebook we can share. But we want you to come on YouTube. It benefits us when you view it on YouTube. And the more you view the video, it helps the channel. God bless you. All the best. Fight back. Do not be a victim. Be a fighter. Somebody say, is Seflin what? Beautiful. Okay, thank you. See you next time in March, towards the end of March. We'll be doing this once every month. Or you have questions, you can still put at the end of the video and we'll answer the question. Thank you. Bye bye. Have a peaceful Sunday and God bless. We end the broadcasting, the technical director, right? End the broadcast.